Drugs for epilepsy. Almost 10% of the population has at least one seizure in their lifetime. Epilepsy is the fourth most common neurologic disorder after migraine and stroke and Alzheimer's disease. Now, epilepsy is not a single entity, but it has a different types of seizures and syndromes, such as sudden, excessive, synchronous discharge of cerebral neurons. The site of origin of epilepsy is abnormal neuronal firing, which will determine the symptoms that will occur. Now, the drugs used for epilepsy are brivaracetam, carbamazepine, clobazam, clonazepam, diazepam, divaproex, escarbazepine, ethosuximide. This is the most important drug mostly used for epilepsy. Felbamate, fosphenytoin, gabapentin, lacosamide, lamotrigine, levetiracetam, lorazepam, oxcarbazepine, perampanel, phenobarbital, phenytoin, pregabalin, primidone, rufinamide, tiagabine, topiramate, vigabatrin, and zonisamide. These were the agents which are used for epilepsy. Now, etiology. Epilepsy is due to genetic, structural, or metabolic cause. The neuronal discharge in epilepsy results from firing of a small population of neurons in a specific brain, which is called primary focus. Focal areas, like you have brain, two hemispheres, there are some focal areas, some this or some any focal area, which will trigger into by changes in physiological response, such as alteration in blood gases, pH, electrolytes, blood glucose, environmental factors, sleep deprivation. Number of causes such as drug use, tremor, head injury, hypoglycemia, meningeal infection can lead to epilepsy seizures. A seizure that is caused by a drug reaction is not epilepsy, and it will not require any chronic therapy. Anti-seizure medications may be needed when the primary cause of the seizure cannot be corrected, but multiple specific epilepsy syndromes that include symptoms other than seizures have been classified. Now, classification of seizures. Focal, which is just deterioration of one focus, one part, one focus, or one hemisphere. Generalized, consciousness is lost, no memory, and it will affect both the parts. Generalized, and it is further divided into tonic, clonic, absence, myoclonic, clonic, tonic, atonic, unknown, epileptic spasms. Now we are going to further look at these. Now, focal will involve only a portion of one hemisphere, and the symptoms will depend on that focus. Focal. Generalized begin locally and progress to abnormal electrical discharge through both the hemispheres of the brain. Now, first one is tonic-clonic. This is a loss of consciousness followed by tonic, that is contraction, and clonic is rapid contraction and relaxation phases. This absence seizures, brief, abrupt, self-limiting loss of consciousness, usually affect children, pediatric, 3 to 5 years of age. The patient stares, exhibit rapid eye blinking. Absence seizure is very distinct. Myoclonic, short episodes of muscle contractions, generally after awakening, and exhibit a brief jerks of the limbs and usually appear in early adulthood. Clonic, muscle contractions. Tonic, increased tone in the extension muscle, generally less than 60 seconds. Atonic, these are not as drop attacks, sudden loss of muscle tone. Now, mechanism of anti-seizure medications. Drugs reduce seizure through the mechanism of such as blocking voltage gated sodium or calcium channels, inhibitory GABA aminobutyric acid. GABA, it impulses and interfering with excitatory glutamate transmission. There are two. GABA is an inhibitory and glutamate is excitatory, which excites. Either interfering GABA or glutamate or these channels, whereas the mechanism of some anti-seizure is not. No. Now, drug selection. Choice of the drug will depend on classification of the seizures, patient-specific variables, age, comorbid medical conditions, lifestyle, personal preferences, and characteristics of the drug such as cost and drug interactions. For example, focal onset seizures are treated with a different set of medications than primary generalized seizures. The toxicity of the agent, characteristic of the patient are major consideration. For the patient which are recently diagnosed, first monotherapy is given. Then compared with those receiving combination therapy, patient receives monotherapy exhibit better medication adherence and few side effects. If the patient is filled, then other management is started. Now have a look at this chart. This is a management therapeutic chart. Newly diagnosed patient appears who is newly diagnosed to epilepsy. First choice, choose a drug which is appropriate to patient's type of seizure. What you have to consider: the toxicity of the agent and characteristic of the patient's pharmacokinetic and dynamic properties, agent's properties and patient's properties. Then gradually titrate the dosage. Now after that, the patient may be seizure free. Okay, management is done, but maybe the seizures still persist. Then you have to go for the second drug choice, titrated to therapeutic level, which will control the seizure before tapering and discontinuing the original agent. If the first drug is associated with significant adverse effect, then it should be tapered when you add second drug. Again, either the patient will be seizure free, done, or seizure will still persist. Then rationale of combination of two drugs, a new drug therapy will be added. Again, either the patient will be seizure free or the seizure will be still persisting. Then you have to consider vagal nerve stimulation, the last.